Hi, I'm Cindy, a chiropractor here at Prevolution Health, and today I want to talk about some symptoms and treatment options for osteoarthritis because it often begins subtly. A bit of stiffness in the morning here and there, a joint that clicks now and then, some discomfort after a walk or a long day on your feet. And these symptoms and changes are easy to brush off because many people assume it's just part of getting older. However, understanding and recognizing the early signs of osteoarthritis can make a big difference in how it progresses and how you feel day to day. And when you can catch it early and take action, there is so much more that can be done to protect your joints and maintain your quality of life. So some common signs of osteoarthritis are one of the most early typical symptoms is joint stiffness, especially in the morning or after rest. Often it eases once you get moving, but it comes back after periods of long inactivity. So other signs to look out for include a dull but aching pain in the joint after use, clicking or grinding when moving the joint, swelling or tenderness, particularly after activity, a sense of tightness or reduced flexibility, feeling like your joint doesn't move as freely or as easily as it used to. So these symptoms can affect many joints, but are especially common in the knees, hips, hands, and spine. Everyone's experience is a little bit different though. So some may notice a sharp pain during movement, while others might feel more of a background discomfort that gradually worsens. So why does early recognition matter? And this is because osteoarthritis tends to develop slowly. Many people wait way too long to address it. But like most health concerns, the earlier you act, the more options you have. It's easier to manage and slow progression in the earlier stages rather than waiting until pain becomes constant or movement is significantly restricted. So taking action early also means fewer compensations in your body. When one joint isn't working well, others pick up the slack. And that can lead to strain and imbalances elsewhere, which is why it's so important to support healthy joint function as a whole. So, what causes osteoarthritis? Osteoarthritis doesn't have one single cause. However, there are several contributing factors, such as previous joint injuries or trauma, poor posture or joint alignment that places uneven stress on certain areas, repetitive movements over time, whether it be from work, sport, or daily habits, weak or imbalanced muscles that affect joint stability, excess weight, which adds pressure on weight-bearing joints. And in many cases, it's not one dramatic event. It's the result of ongoing mechanical stress that the body is trying to adapt to over time. So, what can you do? The goal of care with osteoarthritis is obviously to reduce the symptoms, improve the function, and support long-term joint health. And here's how that can look. So firstly, chiropractic care restores healthy motion and alignment to the joints, especially the spine, which can reduce unnecessary stress on the body. When a joint isn't moving well, other areas overwork to compensate. So gentle chiropractic adjustments help movement patterns. They relieve pressure and it supports a better nervous system coordination. Secondly, movement and exercise. Keeping your joints moving is essential. Specific exercises, strengthening, with stretching and low impact activities like walking, being in the pool, or mobility work can maintain flexibility and reduce inflammation. A movement plan tailored to your body is one of the best long-term strategies for the management and treatment of osteoarthritis. Thirdly is lifestyle support, because what you do outside the clinic here, it also matters just as importantly. So supporting your joints through an anti-inflammatory diet that's rich in whole foods, drinking lots of water, staying hydrated, getting enough rest and to have recovery, managing your stress levels. This all helps reduce the burden on your nervous system and allows your body to function more efficiently. So with pain management, right? Some people may benefit from heat or cold. But then some of a massage or some like vitamins and supplements, even pain medication, right, can play a role for short-term relief. But it's actually important to remember that it often only addresses the symptom and not the underlying root cause. And in more advanced cases, joint injections or surgery may be discussed. However, many people never need to go down that path when they're being proactive early. So you're not powerless with osteoarthritis. It is common, but it's not inevitable or unchangeable. So with the right support, your body can adapt, improve, and regain strength and movement. If you've been noticing changes in your joint, whether it's stiffness, aches, or reduced mobility, it's definitely worth paying attention. Early care creates the best foundation for long-term freedom and function. And in the next post, I'll be sharing more about what happens when degeneration affects the discs in the spine and how that's different from arthritis in other joints. Because it's never just about pain or joints, it's about life.